Okay, so for this last one, I really wanted to make the presentation really cute. So I hope you enjoy. This is Managing Asthma Long Term by Elizabeth Locker. So we're looking at the stepwise approach to asthma. This is adjusting treatment based on the patient's symptoms and level that the asthma is controlled. So basically just, we're going to go over the steps. It's a 6-step approach, but basically stepping down if more control is needed based on off how the patient is presenting, or stepping up if the patient is no longer meeting the needs for that level of severity. So like in the hospital setting, obviously this would look like maybe a patient was originally PRN and they're just experiencing so much shortness of breath. Maybe they're having, maybe they have asthma and now they're having pneumonia set in. And so they need treatments more frequently just to kind of offset that symptom. So like changing the treatment to like Q4 or Q6, just depending on the patient. So some background to this, the stepwise approach, like I said before, is a 6-step approach. There's categories that are broken down by age that make up this approach. So there's 0 to 4 years of age, 5 to 11 years of age, and then 12 and up. Just for this video, I decided to do the 12 and up because 12 and up is basically like the adult range, like 12 and whatever. So that's why I chose that. But this approach is surrounded by the idea of educating the patient, reducing environmental risk, and then also recognizing and managing other disease processes or comorbidities. Sorry, I can't talk right now. So we've got here different strokes for different folks, as some people would say, or different treatments for different ages. So 12 years and up, the first step would be an intermittent. So it's basically just like a rescue inhaler or a SABA as needed. So kind of just very, oh, I just occasionally need my inhaler. Oh yeah, I have a rescue inhaler just whenever I need it. These are the patients that you more want to make sure that their inhaler hasn't expired, because they really only ever use it or think about it when they're really short of breath, and it's so rare that that's the concern. Step 2 is moderate. So with this, you would add on a low dose inhaled corticosteroid. Another alternative to this would be like a mast cell stabilizer, or a leukotriene modifier, or theophylline. Those were just all examples given in the information that was provided to us. With theophylline though, you just have to watch because I guess the serum levels have to be monitored regularly. So monitoring serum levels regularly versus just taking a low dose inhaled corticosteroid, to me that one seems like the better alternative. And then it also more targets the inflammation, but it is also patient dependent. So step 3 is persistent. So now you have a long-acting bronchodilator treatment plus low-dose inhaled corticosteroid. So it's looking at both of those. And then at that point, you may even have to increase the dose a little bit of the inhaled corticosteroid, or use another medication like a mast cell stabilizer or something similar. Step 5, the preferred treatment is still have a LABA, and then a medium dose of an inhaled corticosteroid. So most likely upping the dose, And then at this point, they should be consulting with their asthma specialist or their pulmonologist or whoever kind of manages their respiratory treatment outpatient wise. At that point, they should be consulting with them because they need more than just a LABA and an ICS, or else they're going to be, in the hospital all the time. All right, this is step 5. The other one I said step 5, but I meant step 4. But step 5 is pretty similar. We're just increasing and doing a higher dose of the inhaled corticosteroid. At this point, I'm not exactly sure, depending on what the medication is, like what the dosage would be. But then they would still be also doing a LABA, probably pretty frequently, just because of how severe their symptoms are. And at that point, it would be probably pretty relative for the patient to start some type of allergy medication. This was just one of the ones that was provided to us. Omalizumab, I can never say it, but I know we learned about it last year in the program. But just to kind of help with allergies, a lot of the time, just based off what I have learned so far and also in clinical, at this point, if the patient is needing this level of intervention medication-wise, then it might not just be their asthma. It could be, seasonally, something else is causing this exacerbation, or like I mentioned before in another video, it could be like there's some other underlying issue going on, like kind of like when I was talking about when I was at the PFT lab at Centennial, and the patient was diagnosed with asthma, but she had been, smoking for about 45 years, and they were, pretty sure that she had COPD at that point. So she didn't just have asthma, she also had that emphysematic, that chronic bronchitis component as well. And so all 3 of those things together can really be a recipe for disaster. It can be really hard to manage. So the more that we know, the better, so the easier it is to try to find a solution for, the patient and what can help enhance their life. So at this point, step 6, we got all the things, okay? We got the high dose inhaled corticosteroid, we got the LABA, just like we had before, and now we're maybe adding an oral corticosteroid, just to, throw that in there. No, just kidding, but, just to see if it helps. And then also, consulting an allergist or referring them maybe to an allergist, or encouraging them to see their pulmonologist that maybe they haven't seen in a long time, can just kind of help alleviate, hopefully, some of those symptoms. And then I just put in here as well the rescue medications. So the SABA is a big one, the short acting. Most commonly we see albuterol. Albuterol is a major one, or levoalbuterol, Xopenex, whatever you want to call it. It can be used up to 3 times every 20 minutes based off the level of severity. And then at that point, if you're needing a SABA that often and that frequently, like on a regular basis, then most likely the treatment plan is not working, and that needs to be adjusted. So that's just something to keep in mind. Lastly, I just wanted to make sure I include my references. These are the references for the last 4 videos, as this is the last one in this asthma series. I mainly just used the resources that we were provided in the course. They were so extensive, like especially the pocket guide, but I also went through the presentation and just kind of like picked stuff out that was important to include. And then just to kind of get like a refresher of how to like explain asthma and asthma education, I watched a respiratory coach video. That one is kind of long. I think it was close to like an hour. But it was really interesting, and respiratory coach just explains things so well. So I included that as a reference in here as well, since I did use it as a way to like explain better the, the asthma and severity and everything. So yeah, thank you so much for watching.